Hello and welcome to our workshop on disaster preparedness, response, and recovery. We are so grateful to the Family Cafe for holding their 2020 conference, even virtually. There's always so much good information shared, and I know that we are all better off as a result. So I hope that you enjoy the conference this year, and I hope that you enjoy this presentation because it really is so important. I want to thank Elizabeth Matthews, who is our waiver support coordinator at our and liaison from our state office for the Agency for Persons with Disabilities. She's going to be helping me with the slides, and we're going to be moving forward. So Elizabeth, if we can go to slide 2. I am excited to share this year's workshop with you. My name is Karen Hagan, and I'm the Emergency Coordination Officer at the Agency for Persons with Disabilities. I hope you're staying safe and taking the necessary precautions as we face the COVID-19 public health emergency. This has challenged us in ways we never thought about. And we've had to solve problems we've never had to solve before. And I know that I'm speaking for you as well as myself and all of us. It definitely speaks to the importance of taking the precautions necessary to keep ourselves and those we care about safe. And hurricane season 2020 began on June 1st with COVID-19 still with us. This will prompt us to do some things a little differently as we prepare for and respond to tropical events this hurricane season. You know, spending time preparing for the kind of emergencies that we know could affect us has a guaranteed return on investment. So this session is going to include the kind of information you need to prepare for disasters, respond to them in a safe and effective way, and recover from them, keeping you, your home, your family, and those you care for as intact as possible. Elizabeth, can we go to the next slide? So this slide says that disasters affect everyone, and that is true. When we are talking about a hurricane or a public health emergency, disasters know no boundaries. They do not care how old someone is, how much money someone has, what challenges they face, or where they live. We, on the other hand, can have an effect on how safe we are in a disaster. We need to know what the risks are where we live. If we live in a floodplain, we know that there's a chance that our home may flood. If we live in a hurricane evacuation zone, we know that we may have to evacuate depending upon the size of the storm. We also should know that if we are called to evacuate and choose not to, we are putting ourselves and our family in danger. If our home can withstand wind, is not in a floodplain, and we are not called to evacuate, we should stay home. We are putting ourselves at risk by getting on the road, especially if we do not have to. It's even more dangerous if we don't have a planned destination. Disasters do affect everyone. However, we can have control over how we plan for and respond to them. And that's what this session is all about. Elizabeth, if you can go to the next slide, we're going to continue talking about the disaster impact. This slide speaks to the things we need to plan for. We know that disasters may have an impact on the availability of food and water. We know we should have food and water on hand as part of our disaster supply kit. And we're going to show you a disaster supply kit a little bit later. If we have to evacuate and seek safe shelter, we should have a plan for where to go. And safe shelter isn't always a public shelter. We're going to discuss that in a few minutes as well. We know that thunderstorms, tropical storms, and hurricanes often come with power outages. Those who are electrically dependent need to plan for that. We either need to have a generator or we need to evacuate to a place with power or that has a generator. Loss of power over a long period of time is particularly concerning. The cascade effect of that may include a loss of food, sanitation, refrigerated medicines, and other things. Disasters impact the economy. We know that COVID-19 has definitely caused a disruption to our economy, in some cases individually, in some cases as a whole community, a nation, and the world. Disasters affect our mobility. We know that debris caused by disasters can limit our mobility to get around, sometimes personally, sometimes in a car. We've seen interruptions in the transportation system caused by disasters. We know all of these factors will especially affect individuals with chronic conditions, and those conditions are going to deteriorate over time, and that's why planning is so critical. Disasters can also affect our pets. You know, we have to have plans for our pets in a disaster, and there's some great information out there about what to do for our pets, and there's supplies that we also need to have for our pets, and we'll talk about that in a bit. And we know disasters can cause personal property loss, and that can cause a serious housing issue. For those individuals who were affected by Hurricane Michael in the Panhandle, they are still dealing with the loss of available housing. And these are the kinds of things we need to think about and prepare for. Elizabeth, if you can continue on to the next slide. As we continue to look at the impacts of disaster, you need to look at how they will affect you personally. The type of disaster will affect what might occur. For example, COVID-19 has affected so many people in the ways listed on this slide. We've seen a loss of home-based services. We've all been isolated, and I know there's been diminished natural supports. We've had to do things differently and creatively. Now, some of the solutions individuals have found to cope with COVID-19 may be useful in dealing with other disasters like hurricanes. You know, a lot of times we want to just talk about the hurricane disaster, but who would have thought we would be facing a public health emergency like we're facing now? But disaster planning comes into play for that as well. Interruption of medical care is one of the greatest concerns we face in disasters. The state of Florida includes its agencies like the Department of Health, ACA, DCF, and the Agency for Persons with Disabilities, amongst all others. We've worked together diligently to deal with COVID-19. And I added confusion to this slide because, you know, if you've seen one disaster, you've seen one disaster. They are all different. The severity is different. How many people are affected is different. The destruction is different. And frankly, the resources that are brought to bear are different. Sometimes we have a presidential declaration with federal resources, and sometimes that does not happen. And there's rules and protocols in our state and country that guide those decisions. Much of that is based on the size and scope of the emergency and of the disaster. There has been a great deal of confusion surrounding COVID-19. Most of us, and including our leaders, have never had to respond to anything like this to this degree in our lifetime. It is a virus we knew very little about, and it physically affects everyone who has contracted it differently. But COVID-19 has affected all of us. Elizabeth, if we can move to the next slide. We're going to talk about the emergency management cycle. And I think it's really important that you understand what this is, because it really does mean something to us individually, as well as it is the cycle that our emergency managers at the local, state, and federal level follow. And we're all part of that cycle. And so let's start by talking about the first part of this cycle, and that's preparedness. Preparedness means the development of plans. It occurs on all levels. You know, we need to have a personal disaster plan. We want to know that our state and our counties have plans on how to deal with emergencies. Not all counties, though, have the same level of resources. And I think that's really important, in that when we develop our own plan, or when our counties, our state, or even the federal government develops their plans, they have to list the resources that they have. It's important to know that even in Florida, with 67 counties, some counties being a lot smaller than others have less resources than others. And it's important for us to know what those resources are so that we can manage expectations. You know, that might be, say if it's a county, it might be a coastal county, and all their schools are in evacuation zones. Preparedness includes the development of plans. This occurs on every level, and it includes us individually. We want to know that the state and county we live in has plans to deal with emergencies, and we need a personal disaster plan, and we want to know that our county has a plan and that our state has a plan. But preparedness includes as well learning what resources our counties have, what we can count on, what we can't count on, what we need to do for ourselves. For example, some counties have shelters, but they're all in evacuation zones. So those shelters can only be used for things that aren't caused by a hurricane where people would have to evacuate. Some counties have a transportation system that's very robust and they can pick people up and bring them to shelters. And other counties don't have those resources. What's important for you to know is what resources your county has, the county that you live in, and what you can expect from your community. We don't want to get into the middle of a disaster expecting certain resources to be available to us, and they are not. Response, that's the next part of the emergency management cycle. And response includes life safety and evacuation decisions, sheltering, mass care, which is sheltering, feeding, and maybe bulk distribution of necessities. Sometimes that might mean MREs or meals ready to eat. This is dependent on what problems the disasters caused. The next part of the cycle is recovery, and that includes things like debris removal, emergency housing assistance, health and social services. Again, depending upon what problem the disasters caused and what problems we need to solve. Different resources might become available at the local, state, and federal level, and it's important that we know what those resources are. Economic recovery at all levels comes into play during recovery. And then the last part of the cycle is mitigation. Effective mitigation requires that we all understand local risks, address the hard choices, and invest in long-term community well-being. Without mitigation actions, we jeopardize our safety, financial security, and self-reliance. Elizabeth, if you'll go to the next slide. So as we talk about local, state, and federal government response, let's start by saying for local, all disasters are local. The first assistance you're going to see, or the first assistance to any disaster, is going to be from local responders. And then state, the state will assist local government agencies when they don't have the resources that they need. So they'll help them with response, communications, liaison to the federal government, and more. Federal government, the governor is the only one who can request the president to declare a locale a disaster area, freeing up money and resources from the federal government. And that is also based on damage and risk. Elizabeth, if you'll move to the next slide. Let's talk a little bit more about preparedness. We spoke earlier about preparedness being the first part of the disaster cycle, and its importance cannot be overstated. Here are some examples of what you can do during preparedness. Obviously, the first thing is develop a plan. There's some great links to planning templates like the Florida Division of Emergency Management and the American Red Cross. You can go to those links that are up on the slide and ask to, look on those links and find a plan that you can look at to fill out. I am going to guess, though, that most of you listening have a plan. The next is gathering supplies. That starts with your disaster supply kit. I'll show you some items that you should have in your supply kit in just a couple minutes. Know your community resources. This could be shelter resources, transportation resources. We talked about that earlier. If there's locations that usually provide sandbags, evacuation routes, etc. Especially when we think we're going to get a lot of rain. There's a lot of communities that will say, if you need sandbags, this is where to go to get them. That's a good example of how some communities have those resources available. Some may not, but it's important for you to know which ones do. Communicate your plan to family and to caregivers. Please let your family and caregivers know what your plan is, what you're thinking about. Will you stay in your home if you don't have to evacuate? This hurricane season, I do want to talk about this because it's so important. With an overlay of COVID-19, If you can safely stay at home, I would recommend that you try not to go to a shelter because home may be the safest place to be. Now, if your local officials are urging you to evacuate, you do need to heed their recommendations. But what your plans are and what you actually do should be communicated to the important people in your life, your family, your friends, people who care for you, people who you take care of. And update your plan annually. If you haven't looked at the plan you used last year, get it out, dust it off, open it up and read it. See what might have changed. Maybe some contexts have changed. Maybe there's changes to your evacuation route in your community. And also take COVID-19 into consideration. That's going to affect everybody. So let's look at slides 9 and 10. Let's start by talking about our disaster supply kit. These two slides that we're going to show you list a great many items that should go in your disaster supply kit. There are so many sources of this same type of information, things like water for drinking, cooking, and sanitation purposes. You want to pack a minimum of 1 gallon daily per person for 3 to 7 days. That's water. Food for a minimum of 3 to 7 days and include a hand-operated can opener, sleeping bag, clothing, flashlight with batteries, a battery-operated radio, prescription medication, PPE, and you've probably heard a lot about PPE during COVID-19. PPE is personal protective equipment, things like masks, hand sanitizer, and gloves. Also, pack cash. You need to make sure you have some cash available and put your important documents in plastic. And if you have a pet, have food and supplies for them. Response, that's slide 11. Elizabeth, if you'll move us next. We spoke about preparedness. Now let's talk about response. This is where true life safety actions come into play. First responders such as fire, police, and EMT are active during this time. They're trying to protect our citizens and our communities. Decisions about evacuation and sheltering come into play. Remember, we said you want to have a radio and with batteries, a battery-operated radio, so that you can continually listen to the radio and listen to what your local officials are saying. They're the ones who are going to tell you what to do, and we need to heed their advice always. And so first responders are always trying to protect our citizens and our communities. Decisions about evacuation and sheltering comes into play here, and this is where listening to your local officials is so important. Emergency management agencies are responsible for coordinating all of the government services in your community that need to be part of a response to a disaster. At the State Emergency Operations Center, every state agency is represented and have emergency coordination officers like the role that I play at APD. So we've got one state emergency operations center, and then there's another emergency operations center in each of the 67 counties in Florida. We work together, and whether we're talking at the county level or the state level, we work together to try to solve problems each of our consumers and constituents have. For example, if you're an APD consumer and you let your regional operations manager know about issues you're having due to a disaster, this might be an issue that your county emergency management agency can solve, or it might be an issue that they need to raise up to the State Emergency Operations Center. And having representatives like we do at the state EOC is so important because we can try to solve those problems. And sometimes we'll solve them because we need to solve them with ACA, or we need to solve them with the Department of Children and Families or the Department of Health. And, and a lot of what happens in those EOCs are solving problems for you. So it's important that you raise those issues up. Elizabeth, if you can go to slide 12, we're going to talk about recovery. Recovery can last a couple of weeks or it can last many years. It depends on the size and scope of the disaster. In Florida, in some areas, we're still recovering from Hurricane Irma. And in the Panhandle, we're still recovering from Hurricane Michael. On the slide, we show FEMA represented, and they are often involved in recovery, representing the federal response. But if the size and scope of the disaster event doesn't warrant it, then FEMA resources may not be brought to bear. And not all FEMA services are brought to bear even when FEMA is involved. And that's why you being very well informed about the resources that are coming into play after each disaster is so important. There's very specific triggers to activating the various FEMA programs. So it's important that you pay attention to what resources are available during disaster recovery. As an example, during Hurricanes Irma and Michael, FEMA provided the Transitional Sheltering Assistance Program, or TSA. And that was because people who applied to FEMA were unable to return to their home because it was either uninhabitable or inaccessible due to a presidentially declared disaster. There were specific hotels that were part of this program, and people were allowed to go to those hotels, and that was paid for by FEMA. But in a situation where people can get back to their homes and there is shelter available, the TSA program may not be utilized even when there's a presidentially declared disaster. So it's important that we keep our eyes and ears open and really learn about what programs are going to be delivered after disaster. Also during recovery, the following activities may occur in affected communities. And I wanted to list them for you because they're the things that you're going to want to look for. First, you look at bulk distribution or pods. Pods are points of distribution, and these are opened when stores cannot be opened for a time due to the disaster, but people still need things. They still need water. They might need food. A lot of times you see pods distribute MREs, or meals ready to eat, and other essentials like bug spray or hand sanitizer. Again, this depends on the emergency conditions. And again, that's why it's so important that you know what's going on in your community. A really good source of information for you after a disaster is your county emergency management website. Another thing you're going to see is debris collection. That also occurs during recovery, and it's so very critical, especially if roads are blocked with debris and emergency vehicles cannot pass. Another thing you may see are information centers, and those are set up. It might be set up by the state, it might be set up by the county, it might be set up by the federal government, and it helps people understand what resources are available and how to apply. And sometimes this is done virtually. I think if you live through a lot of the recent disasters in Florida, you hear about a FEMA 1-800 number, and that would be a way for people to apply virtually. And I would expect, because we still have COVID-19 with us this hurricane season, if we are hit with a hurricane, I think we're going to see more and more virtual assistance in regards to information. The Individual Assistance Program, that's both state and federal. It allows individuals to request basic necessity assistance, again, depending on the extent of damage and if there's a declaration. And there's always coordination between the county, state, and federal resources. And that's what occurs at the County and State Emergency Operations Center. And that's there for you, so to help you recover from emergencies. Elizabeth, let's go to the next slide and talk a little bit more about mitigation. It includes all of the things listed on this slide. Being educated about your risks, what to do to make your home stronger against the wind, trying to move to a home in a floodplain, etc., are all mitigation measures. Mitigation efforts by everyone affects how resilient we are individually and as a community. Let's talk about sheltering. Elizabeth, if we can go to the next slide. There's two types of shelters, public shelters in Florida. There's general population shelters and there's special needs shelters. For your safety and the safety of those you care about or care for, if at all possible, going to a shelter should be your last resort. If you don't have to evacuate because local officials have deemed where you live is safe, you should stay home, especially if your home is built to withstand wind, in the case of a hurricane, for example. If you need to evacuate, though, then during preparedness, think about where you might evacuate to, such as a friend's home or a relative's home, someone who lives inland and safe. Think about multiple solutions and have those conversations with the people who you might be able to evacuate to and stay with for a little bit after a disaster, or even before if we're talking about a hurricane. Let's I want to mention a couple more things about a general population shelter. You know, you see we have a picture of a lifeboat there, because going to a general population shelter should be a last resort and looked upon as a lifeboat. If it's your only choice, then and you have to evacuate, then that's what you need to do. They are responsible to have basic first aid, and they do want to make sure that they're accessible to everybody. You know, generally during non-COVID-19 times, you might expect to be in a shelter and there might be 10 to 20 square feet per person between you. But because of the need for social distancing, the planning is looking at even 110 square feet per person in a general population shelter. What that means to you is that there's not going to be as many people allowed in the shelters we normally think of going to. And that's important for you to know. And that's why your planning is going to be so important this hurricane season, and to be thinking about an alternative location to go to. Let's talk about special needs shelter. Elizabeth, if you'll move us to the next slide. This should also not be your first option. As you know, the comforts of friends or family are going to be so much better than any shelter you might be able to go to. But I do want to let you know, if going to a special needs shelter is something that you're wanting to consider, you do need to register on your county emergency management website, and you need to register annually. Don't think your registration of 2 or 3 years ago is going to carry you through. So you need to register annually. Plus, it allows your emergency management agency to do appropriate planning on their part. Usually we see individuals who might be medically fragile or oxygen dependent or electrically dependent planning to go to a special needs shelter. But again, we're going to see a lot. This says 60 square feet per person, but I believe this summer, because of COVID-19, they're going to need to have a whole lot more space between people because of the need for social distancing. So it's definitely something you need to think about. Let's move to the next slide and talk about alternatives to shelter. You know, when you're not in an evacuation zone, you may not need to even leave your home. So know your zone, know your home. Go to your emergency management website, know what evacuation zone you live in, know how strong your home is and how much wind it can resist. APD has licensed group homes, and using a host home approach is really preferred. We would love to see, and good planning is happening statewide, trying to find host group homes where people could evacuate to. It'd be so much better for the individuals. We can combine resources. There's an improved level of supervision and response resources. And obviously it's a better environment. And it's a place where services are going to be flexible. Elizabeth, let's go to the next slide and talk about evacuation. If any of you have evacuated before, you know there's always issues with evacuation. Sometimes it can take upwards of 20 hours to even leave the state of Florida. Often we see gas shortages, we see high prices, we see road rage, we know that there's service limitations. Sometimes if everybody is flooding into hotels and there's lack of hotel space, that does lead to an overuse of shelters. That'll definitely be a planning focus for emergency management. And that's why your plan, again, is so important. You want to follow it, know where you're going. And if you're going to evacuate, don't delay and go early. I just wanted to share a slide with you. Go to the next slide, Elizabeth, please. APD's roles. These are just some of the roles that we have in emergency. It's really what we do all the time to make sure that we are prepared for and we can respond to and support our consumers. And really, a lot of the things listed on this slide are the same type of planning and response that we see with all of our sister agencies, and also agencies at every level. So I thought you'd be interested in knowing that these are the kinds of things that we are looking at, we're planning for, and that we end up responding to. We have a comprehensive emergency management plan. We know what our concept of operations are and how we're going to operate. We really have thought through what our mission essential functions are so that we can continue to serve our clients and our consumer. We know who's in charge. We know where we may have to go to if we can't work out of our office. Now, interestingly enough, this summer, there's, with so many people teleworking, we're actually, we use the word COOP, continuity of operations planning. We're actually cooped, and we're responding to COVID-19. We always have designated representatives at the State Emergency Operations Center, and we communicate essential information to consumers and providers and our waiver support coordinators and our staff. We have a really great section on our APD website that really, for COVID-19, that talks about the resources available and the information people need to know. And we have a toolkit that we keep up year round, which will help people prepare for. And there's a lot of the links that you saw in this slideshow. A lot of those email addresses are up on our disaster recovery toolkit on the APD website. And we work with partner agencies. We work with them before, during, and after a disaster. Elizabeth, let's go to the next slide and talk about how important it is that we gather the right kind of information that we need to solve problems. We present the issues you have during emergencies to our state emergency response team when they're activated. We find out through our regions and our waiver support coordinators the kind of things you're dealing with and what you're facing and what your questions are. And we really want to know what's happening in our licensed group homes, what's happening for individuals in supported living or individuals in the family home, what's happening to folks in our APD managed facilities. So that kind of information gathering is happening daily in an emergency. We have ongoing, during COVID-19, we've had ongoing calls and conversations with a lot of individuals, a lot of our providers, our waiver support coordinators, our staff, and our partners in the state to make sure that we're all on the same page and we're trying to solve problems together. Elizabeth, let's go to the next slide, response and recovery resources. I wanted to let you know about some of the resources in case you needed them. As we've been talking, there's a lot of great information on the local and state emergency management website. The Florida Department of Health has extremely good information about COVID-19 and other preparedness resources as well. I already talked about our APD website, our recovery toolkit. We also have a resource directory that we keep up to date all the time. And so communication is key. I cannot stress it enough, how we communicate with each other, how you communicate with your caregivers or the people that you care for, how you communicate with your friends and families. It's key to successful recovery. APD, we want to know about how you're doing and what your questions are. We want to continue to provide you with information that you need. And we want to be able to provide you with the resources that Florida has been able to bring to bear. It might be federal resources, they might be state resources, they might be local resources. We've used our Everbridge emergency notification system during times of disaster to provide critical information. And we share the news releases coming out of our governor's office, who's really tried very, very hard to keep everybody up to date on whatever the latest emergency is. And we will continue to communicate. We'll continue to set up conference calls with providers and waiver support coordinators and our partners to provide and receive the latest information and field questions. Elizabeth, let's go to the next slide, please. Let's be disaster ready. We need to start with ourselves. We need to make sure that we have our own plans in place, because we can't help anybody else if we're concerned about ourselves or our families. So we need to have our own personal plan in place first. The Family Cafe wanted this session because they want you to be disaster ready. On one of the links, you're going to find information about preparedness for individuals with disabilities. And there's 3 important themes I want you to remember. There is no one-size-fits-all disaster or emergency. Know your county. We've talked about that. Know where your evacuation routes are, and if you need to evacuate. Know what radio station to listen to for important information from local officials. We want to take an all hazards approach. Think about what risks you face. Do you live on the coast? Are you near a river that floods? Do you live near a nuclear power plant? Is your community affected by wildfires? It's important that you know your risks so you can plan for what to do in these events. We spent a lot of time talking about resources, both the resources you should gather for your disaster supply kit and when government resources might be available to you. And there's lots of great templates for written emergency plans. APD has provided a template. Emergency management has templates. FEMA does. The Red Cross does. And your county emergency management website is full of good information for you, and that's specific to where you live. CEMP for group homes, I really just wanted to share with you that we have a really great new template, which is a comprehensive emergency management plan for our APD licensed group homes. It takes into account all the principles we've been talking about today, and it takes into consideration the needs and requirements of our consumers and the group home they live in. So let's look to the last slide. One of the last slides we have is called the plan, and I wanted this to be really one of the final slides I have for you, because you've heard the saying, when you fail to plan, you plan to fail, and that is so true for emergencies. We care about you, and we want you to take the time to plan for disasters and emergencies. As you begin your planning or update your plans, you may come up with questions. They might be questions you want to ask your family, your caregivers, your emergency management director, or an agency you're associated with like APD. Ask those questions. The plan should be a living document, and it should be ever changing because nothing stays the same, as you know. The key to planning is the process. It's the conversations that you have. It's the questions that you ask, and it's the what ifs. Ensure that those who are tasked with a role in your plan are aware of that, and they remain available to you. If you expect that a friend or relative is going to pick you up and bring you to a safe place, make sure they know that's what you expect of them, so they can be there for you if possible. And make sure you have everyone's current phone number listed in your plan. And for that matter, if you've got everybody's current phone numbers, make a list and put it on your refrigerator so you know who to call first. Have everyone in your family. This is an example of a good piece of a communication plan. Have everyone in your family have a relative who lives out of state, get their phone number, and everybody in your family should call them no matter where they live, because sometimes if somebody lives out of state, you can reach them easier than someone who lives in a disaster-affected area. So it's important that you let them know that you're all safe and well. And practice. When I say practice, even if you hear about a disaster in another area of the state or country, think about what you would do if that was happening to you. Look at your plan and see if it covers it. Ask questions. And Elizabeth, if you'll go to the last slide. I know I've covered a great deal of information today. I hope it helped you think about your risks, your plan, and what you will do if a disaster happens to you. As you know, disasters can happen at any time and any place. Their human consequences are hard to predict. But if you have a plan and you know what questions to ask and you communicate before, during, and after an emergency, you can really mitigate the effects of a disaster on you, those you care about, and those you care for. Thank you so much for listening today. And we just wish you a very, very safe hurricane season. And we hope you stay safe during COVID-19. Thank you.